Good day, viewers. Today I'll be talking on breast cancer because we're in October and October is breast cancer awareness month. And don't forget, it is my month also. Now, what is breast cancer? Breast cancer is a type of cancer that forms in the breast sacs. The causes of cancer generally is unknown. But what you know is that it is abnormal growth of cells which will continue to accumulate to form a lump or a mass. And the same thing happens in the breast cancer. There's accumulation of abnormal cells in the breast that form a lump or a mass, which can also be spread to other parts of the body. Now, breast cancer is very common among the women, though it can occur in men too, but it's very, very rare. And the yearly diagnosis is very important in management of breast cancer. Breast cancer is very, very common. I think it's the most common cancer that is being diagnosed among the women. Now, what are the signs and symptoms? Signs and symptoms of breast cancer goes like this. One, we have lump that is very different from the breast tissue. Breast lump, it is very different. You see it. We have bloody discharge from the nipples. You'll see a discharge which is bloody, then this is a sign of breast cancer. 3, we have sudden inverted nipples. Your nipple is straight before and suddenly you see it's inverted, going to another side. So this is some of the signs and symptoms. Then change in the size, appearance of the breast is also signs of breast cancer. And there's a changing in the tissue, the skin generally. There may be peeling, there may be redness, there may be dimple like this in the breast. So these are some of the breast cancers. If you're having these, don't diagnose or don't think you have a breast cancer. You have to talk to your provider, healthcare provider, to be checked if definitely you have the breast cancer or is something else. So these are some of the signs and symptoms of breast cancer. So now let us look at the risk factors. What are the risk factors? One, being female. If you are female, you're at risk of having breast cancer. Number 2, obesity. Alcoholism. Some people who are taking alcohol are also at risk of having cancer. Then aging. As you grow up, you are more at risk of having breast cancer. Then if you have never given birth before, you're also at risk. If you have history, family history, maybe some of your father or of your mother have a cancer, or let me say your mother having a breast cancer, there is just that probability, because 5 to 10 people diagnosed with percentage diagnosed with breast cancer are related to genes passing from family to another generation. So it can happen from one family or from one generation to another. Yes, it can happen between the family passing of this gene. So it's also a risk factor. Now, having your first child in the old time, maybe you are older, maybe you are 60 or 65, you are having your first child, then you are at risk. So these are some of the risk factors of having this breast cancer. Now, let us quickly look at the importance of self-breast examination. You need to learn how to do self-breast examination, because when you learn this, you're able to detect any abnormal from your breast, so that you check your healthcare provider if it is normal or if it is abnormal. So now, if you know how to do breast self-examination, fine. If you don't know, chat to me. Send me a message. I will send a link to you where you read on how to do breast self-examination. If you're a man watching me, please pass this message to your woman. And if you're a woman, try to learn it and practice it. Thank you and God bless. And happy birthday to me in advance. Thank you. Bye-bye.